Hello everyone, this is Dr. Ramya from Team MDS CONQUER. In this video, we are going to discuss 32 important points from the topic of lab procedures of fixed prosthetic dentures.
Point number 1. Type 1 and 2 gold alloys can be used satisfactorily for intracoronal restorations, whereas type 3 and 4 can be used for crowns and FPD. Number 3. Stops are made by removing wax at angle of 45 degrees to occlusal surface of 3 teeth that have a tripodal arrangement in the arch. This lends stability to the tray and 45 degree slope helps center the tray during insertion. Number 5. Thickness of tin foil to be placed over spacer wax for special tray used for dentulous impressions is 0.025 mm or 0.001 inch. Number 6. The wax may melt from the polymerization heat of the material used for special tray fabrication. Thus, foil prevents it from contaminating the inside of the tray. Number 7. To avoid distortion from continued polymerization of the resin, the tray should be made at least 9 hours before its use.
Point number 8. When a tray is needed more urgently, it can be placed in boiling water for 5 minutes and allowed to cool to room temperature. Number 9. The porcelain on the tissue surface of the pontic should be as smooth as possible. Number 10. Pits and defects make block control difficult and promote calculus formation. Point number 11. The metal framework must be highly polished with special care directed to the gingival embrasures. Number 12. The chief cause of ridge irritation is the toxins released from microbial plaque which accumulate between gingival surface of the pontic and the residual ridge, causing tissue inflammation and calculus formation. Number 13. The surface to be joined by soldering should be flat, parallel and controlled distance apart. The soldering gap of about 0.25 mm is recommended. Point number 15. In fixed prosthodontic treatment planning, complex decision as to the best preparation path of withdrawal combination can be greatly simplified by diagnostic cast tooth preparation and by waxing. Number 16. The connectors of interim fixed partial denture should be over-contoured. Number 17. While adapting foil for alumina coat ceramic crown, foil should be trimmed so that one end is exactly twice as long as the other. The long end is carefully folded over the short end, and margin discrepancy at the thinner's joint can be reduced by removing a triangular section of foil. This is done at the lingual surface. Number 19. The waxing technique used for cusp marginal ridge occlusion was originally devised by E.V. Payne and was the first wax added technique for functional waxing. Number 20. The hardest of all abrasives is the diamond. Now let's see the hardness of different materials. For silicon carbide it is 2500 kHn, emery 2000, aluminum oxide 1900 and for diamond it is the highest 8000 kHn. Point number 25. Rock is composed of iron oxide. It is the finest of all polishing agents used extraorally on gold castings. It is applied with a soft bristle brush or a small muslin bluff wheel, also used to fabricate crocus discs. Now let's see some commonly used materials, where and how they are used. Point number 28. It is Joe Dandy disc, also known as separating disc. They are generally stiff and cut on edge as well as on the side. They are commonly used for removing sprue, sectioning FPD, contouring embrasures around the pontics. Number 29 is Morse disc side with various grades of garnet, sand, emery and kettle. These are usually used for contouring and smoothing large convex areas on golden resins. Number 30. It is meatless stones. These are extremely coarse in nature. They are used for bulk removal of metal. And 31. It is brushed silent stone. It is an extremely coarse material used for bulk removal of metal. Number 32 is greenstone. It is used for shaping metal and porcelain and is composed of medium grit containing silicon carbide. That's it for today's 32 series, guys. Hope you all note down these points. Revise well, study hard and don't waste time. All the best.